Welcome, everybody. This is Robin Phillips, and I'm the Director of National RTAP. And we are starting our Community Rides Grant Project Outcomes Lessons Learned webinar. And thank you for joining us today. We have two of the grant managers here and available who are going to help lead this. And the welcome and housekeeping is the recording and the slides will be posted at National RTAP Training and Webinars. You can get that through our YouTube channel. Question and answer stuff should go into the Q&A box for Zoom to be addressed at the end. And if you are having trouble with Zoom, please chat us. Let us know so we can fix it. And please fill out the very brief post-webinar survey at the end of this webinar so that we can find out what worked for you, what didn't, and how we can improve what we do. And please stay tuned for additional webinars on for more of our grantees and to talk about the issues that you hear about today that you would like to learn more about. Next. National Rural Transit Assistance Program, or National RTAP, is a fully funded technical assistance center funded through the Section 5311 program, the rural program through FTA. We provide free training materials, technical assistance to rural and tribal transit providers and state RTAPs. We are guided by a review board of 14 members, 7 state DOTs, and 7 well, actually, we're moving to 15 members next year, and 7 state DOT and 8 transit managers, and at least one of those will be a tribal manager, tribal transit manager. So go to our website, nationalrtap.org, and we are ready to help you realize your transit dreams. Next. The resources we provide are training and information. You can get, you can ask us questions. We have information about specific things. We have tools to help you procure, cost allocate for when you're doing projects with other people, that you can accurately cost out the cost of providing extra service or more trips. Website building, improving public access to the services you provide, and GTFS to engage trip planners, the national ones through Google Maps or Apple Maps or other trip planners in your area, to help people make itineraries that deliver very specific itineraries for people. We provide opportunities for peer networking through roundtable phone calls and other conference opportunities. And you know what? You can just call us up and Kara will answer your call and answer your questions, hopefully, and bring other people to the table to help you with technical support. Next. And we also are hosting, and Kara created, the Technical Assistance Coordination Library. And this is where all of the TA centers that FTA funds bring resources to the table to help you with your coordination questions and ideas about how to implement the partnerships that you're trying to put together. Next. Q&A. So do you have any questions before we start? Nope, this is going to be see it at the end, and now we're ready to go to our presentations. Karen, do you want to introduce our first presenter?
Actually, I think Scott had something else he was going to say first.
Super.
Scott, you're on mute.
Sorry. My computer decided to crash right before this, so I had to completely shut it down and start over again. So I'm really sorry about that. But no, I just wanted to quickly introduce like what the what this program was and is, and just talk a little bit about, you know, community rides and you know, what we did with it. So it's you know, there's probably a bunch of people on here that are not familiar, so I just wanted to quickly go through it. And I apologize if I repeat anything that Robin said while I was logging back on, but Yeah, so we decided to do this grant program a little over a year ago, and we ended up funding about 19 or exactly 19 projects, and they were all $100,000 or less. They ranged from about 30,000 to up to 100,000, and the idea was it was kind of seed funding for people to or for agencies and organizations that provide transportation to go out and find partnerships that could provide sustainable funding for these projects into the future. And I'm happy to report that the vast majority of them did actually get funding. A lot of them got private funding from everything from healthcare organizations to business partners. We had, let's see what else we have, dental practices, substance abuse centers, veterans agencies, employers, education, colleges, community action organizations, senior centers, even sheriff's offices for putting people back out into the workforce after maybe being incarcerated, grocery stores, tribes, other social services, nonprofits. So the idea of this was to create sustainability and partnerships with not traditionally transportation related groups, but that do either benefit from or touch transportation in some way. And then just some quick examples of like things that people did. I don't want to take too much time because I want this to really be about you all and your projects. But we had some people expanded service areas, hours of service, dispatching, scheduling, other types of software updates that were needed. We had electric vehicles, which we'll probably hear some about, microtransit, marketing, van pools, same day pickups. So it really was a lot of great stuff happened here, and we're very proud of it. And again, like I said, almost all of these projects have gotten sustainable funding either from county government, state government, private sector, everything in between. So I just wanted to talk about that, and also the fact that we'll probably be doing a slightly scaled down version of this in the future as well. So just keep your eyes on our newsletters, and you'll see in the future. We don't know when it will be yet, but we will be doing something similar to this again. And that's really all I had to say. Just kind of wanted to talk to like what the program is and what we did. So who is
No,
advancing the slides right now?
I will.
Okay.
Okay.
If you need to share the screen, or you need me to share my screen, I have the slides up as well. So without further ado, I will hand it over to Fresno County. Unless Karen, you had anything to say?
Very good. Thank you so much, everybody, for attending. This has really been fun and exciting projects. Everybody has really stepped out of the box as far as trying to put something different together for transit. So we're excited to be hearing more from some of our grantees.
And I believe this will be Janelle, right?
Yes. Hi, everyone. My name is Janelle Campo, Deputy Director with Fresno County Rural Transit Agency. I'm joined by my General Manager, Moses Stites, and Tania Schleck with Walker. She was the consultant that worked on this project with us. Thank you, RTAP, for having us. We're going to talk a little bit about the RTAP study and the project that we implemented. So just to give an overview of our services, we're located in Fresno, California. We provide transit service in the rural communities throughout Fresno County. many of which are considered disadvantaged per the CalVirus screen. It indicates that these communities suffer from a combination of economic, health, and environmental burdens. We cover a very large service area, almost 6,000 square miles across the county. We provide intracity demand response, which is a dial-a-ride service within the 13 rural incorporated cities. And we also provide fixed route service between cities, which are the colored lines you see on the map and legend there. Our longest route is probably from Coalinga to Fresno, which is over 60 miles one way. There are 39 unincorporated areas in Fresno County. And we also have a rural transit dial-a-ride service for these areas that are outside the sphere of influence of the incorporated cities. This service is designated for lifeline purposes only, so for things like doctor's appointments or to go to the pharmacy. FCRT is also transitioning to zero emission vehicles. It's a CARB requirement. We currently have about 120 vehicles in our fleet. A third are gas, a third an electric, and a third are CNG. And it consists of everything from as small as the EV sedan, and then we also have up to a 40-foot electric bus. Next slide, please. So as I mentioned, we cover a large area and 39 unincorporated communities. And so we began to plan and study other alternatives to try and address any service gaps in some of these smaller rural unincorporated areas. It started with a study in partnership with our MPO FCOG on a car share ride share plan, which looked at car share and ride share and microtransit, as well as how it would be operated and ownership models. We also looked at service areas and corridors and service model options. Next slide, please. So through some of our planning, these are some of the parameters for the rural microtransit that we were looking at implementing. There would be areas or corridors that a vehicle would service. It would be an on-demand service. It'd be operated by our subcontractor. The vehicle would be an electric sedan. This is due to range and ridership. And it would provide trips to the incorporated areas, so to the metropolitan area, or connect to one of our fixed route stops. We were looking at kicking this off in the unincorporated community of Biola, which is located about 15 miles west of Fresno and has a population of about 1,300 people. We wanted to try this rural microtransit in Biola first because we've tried other more traditional transit in this community, such as like a fixed route service, and they've been unsuccessful. And Uber and Lyft isn't an option because the high cost for the trip and because of the distance to the rural location. Next slide, please. So here's some more of the details of the rural microtransit that we developed and implemented in the unincorporated community of Biola. Our subcontractors operate in the service and providing the insurance. Some of the other unique things about the service is we hired a local driver from the community, and the vehicle is parked in the community to eliminate deadhead. And we also used our existing dispatch and phone numbers so people could call in and request a ride. Partnerships were also crucial for this project from our funding sources, as well as the Biola Community Service District and the League of Women Voters. We worked with the Community Services District to park the vehicle at that location, and we also installed a charging unit and a security gate at their site since we're using the electric sedan for the service. So we also needed the charging infrastructure. We also worked with the Community Services District to include information in the mail that goes out to the residents to help promote the service and try and help with ridership, as well as help with driver recruitment. And then the League of Women Voters donated $12,000 to this project, and we've been using that for funding for the fares. So we were able to offer reduced fares for the passengers. It would have normally been a $10 one-way trip, and it made it $5 for the passenger. Next slide, please. Excuse me. So we kicked off the service on June 16th, 2023, and had a ribbon cutting event. The service has definitely had its challenges, but I'll start with some of the positives. Some of the benefits include the ones that I already mentioned, such as hiring a resident from the community, using an electric vehicle and having it stationed at the community services district, eliminating the deadhead, and of course, reducing the greenhouse gas emissions and improving air quality. And then another benefit is the trips that we've been able to provide. The majority of the trips have been to healthcare or clinic appointments in the city of Fresno or the neighboring city of Kerman, as well as trips to the local community college. So that's been a big positive to see what kind of trips we've been able to provide for the service. Some of the challenges have been keeping the driver staffed. We've had turnover for the Biola driver position, and it's been difficult to fill. Also, the ridership's been low for the service since we started. We would maybe get 1 trip request a day to maybe 3 trips a day at its highest, and it's been consistently low more recently. Also, we're finding that the costs are still high to operate this type of service. The service is real-time reservations. We originally started the program requiring 24-hour advance reservation to be able to better schedule the trips efficiently and schedule the driver. However, we met with the community services district and decided to change it to real-time reservations to try and increase ridership and attract additional passengers. However, it's been more difficult because we've had a harder time grouping passengers and scheduling the driver because the driver doesn't work an 8-hour shift. They just work as there is a trip request. So there's been some challenges with that. We're still operating the service currently, but we're continuing to monitor ridership costs, and we're looking at other options. Next slide, please. I'll turn it over to Tania to discuss the RTAP study. Thank you.
Thanks, Janelle. As Janelle mentioned, FCRTA has implemented the Biola microtransit service, but, is also looking at, other communities in Fresno County to deploy the service to, and that's the RTAP service, or the RTAP study was focused on communities in West Fresno County, unincorporated communities, and so FCRTA partnered with Walker, which is where I work, and to lead the transit analysis, as well as Leadership Council for Justice and Accountability. They're a local advocacy organization that are well connected with the community, and they were really fundamental in our public outreach effort and getting survey responses. So they were our other partner on the project. Next slide, please. So this map is showing the communities that were part of the study. The pink dots are the unincorporated communities, Layton, Riverdale, Lanier, Cantua Creek, El Porvenir, and Three Rocks. So these were really the communities that we were targeting expanding service to. So as a result of the transit analysis, we recommended 3 different zones to better connect these communities with major population centers, employment centers, and healthcare facilities. Next slide, please. So as Janelle mentioned, one of the stakeholders of through the RTAP project was the League of Women Voters, and as she mentioned, they helped to subsidize the fares in the Biola service, to help market the service, and we through this study we gained a lot of great feedback through survey responses of people who live in the unincorporated communities to really understand travel preferences and travel patterns for future planning of microtransit or potentially other types of service in the rural areas. And also importantly, the completion of the study really helps position FCRTA for future grant funding for implementation. Next slide, please. So the microtransit service planning is closely tied with FCRTA's microgrid study, which they just completed. And so these are looking at deploying microgrids in rural communities that would include solar infrastructure and the energy generated from the solar would be stored at in a battery for use in low sun conditions or overnight. And so the idea is, while the microgrids would be connected to the power grid, they can also operate independently if there's a power outage. So FCRTA is trying to really reduce their impact on the grid and improve resiliency for communities. So the microgrid study identified 5 initial sites to deploy microgrids, 4 of which overlap with the zones as that were recommended in the RTAP study. So there's a lot of overlap between those 2 efforts. And meanwhile, there's also the Fresno Council of Governments, the local Council of Governments is looking at implementing mobility hubs throughout the county as well. So there's a lot of overlap with the microtransit service planning, microgrids, and mobility hubs. So I'll turn it back to Janelle to talk about next steps.
Thank you, Tania. So next steps for us following the RTAP study and our demonstration project in Biola. So the Biola Microtransit project is still in operation, and we're still working to hire a local driver in Biola. As I mentioned, the ridership's been low and with the service, so we're looking at other alternatives. One possibility is getting a vehicle for the Biola Community Services District, and they could maybe operate the service themselves and have it be sustainable. Next steps for us, we're also looking at funding opportunities to deploy similar types of projects, this type of project in other incorporated communities, such as the ones we analyzed in the RTAP study. But one of the challenges has been charging infrastructure, since we're utilizing electric vehicles for the service. So we're looking at funding for capital for charging infrastructure to support the electric fleet. And the RTAP study really puts us in a good position to be able to apply for this type of funding. As Tania mentioned, we did a microgrid study that analyzed 5 locations in rural Fresno County that looked at costs and site feasibility to see if microgrid with solar and chargers is a possibility to be able to charge our fleet. And we're also going to apply for kind of a phase 2 of the microgrid study through a Caltrans planning grant to look at microgrids in the unincorporated communities, and it would analyze sites that would have chargers, solar and battery storage, and as well as if it's possible for them to operate off the grid. Not having the infrastructure in place has been a big challenge for us in deploying our electric fleet, so we're trying to look at that as well as other technologies in order to not put too much strain on the grid. We're also currently doing a charging master plan. This study is evaluating locations where charging infrastructure is needed, the types of equipment, cost of equipment, grid capacity, and then whether it could be integrated with any future microgrid sites. The idea is to continue to build on some of our previous and existing efforts and continue to plan for the infrastructure needed with all this new technology, as well as the operations to try and deploy these micro transit services. And I think I will stop there. Thank you, everyone.
Great. Well, thank you both for that really good presentation, and glad to see your project, or that the funds that we provided were beneficial to doing some studies and getting some service on the road. That was the whole goal of project. So our next program that we're going to highlight is the Michigan Transportation Connection, and we have Rochelle on, Rochelle Cotey, who does wonderful things in Michigan. She found a lot of partners on this project, and I don't know, Kara, I did convert this to a PowerPoint. If you want me to share my screen, or if this is fine, then that's also fine.
If you have it as a PowerPoint and you can share your screen, I will stop sharing now.
Okay, I'll give it a shot.
Okay.
Is it up?
Yeah, you got a little bit of everything else around it, but yeah.
All right, let me retry this here.
All right. Whoops. Screen now.
All right. Share screen. Shoot. All right. Somehow I lost it again. My computer is not acting normal today. I'm sorry. I have it right here though.
I'll do it.
Okay.
Okay. Are we ready?
Sure. Take it
Okay.
away.
All right. Hello, everyone. Yes, we are the Michigan Transportation Connection, and you can do the next screen. We are in the state of Michigan. We are a 501(c). We are a broker, and we're a private nonprofit. So we're sort of interesting, across the country because most of them are private for profit. And we started in 2014 as a volunteer driver program, but then we changed it over. If we can have the next screen, we changed it over to next screen, please. Okay, so then we changed it over, our model, and to a Rides to Wellness program. And next screen. So anyway, just a little bit of background. We started our first service with a AAA, which was for 10 counties. And we did the My Choice Waiver program, which is the Medicaid program. And from that, we were able to start expanding to all other counties. And if most of you know, Michigan is a rural state. I think out of 83 counties, 79 counties are rural. So we're a pretty big state. So we have quite a big challenge. Do we have all the counties yet? No, but we're working on it. Okay. So, and what we really wanted to do was get transits more engaged in the brokering service, and that we would do the work for them. And the whole concept is to send them the rides, and we do all the paperwork, and all they have to do is bill us for the rides. So the next screen, please. And also, I just want to mention with transit, they have all the infrastructure in place, so why not use transits? And this is a discussion we're having constantly with the state, is that there's not enough brokerage programs using transits, and we would like to see transits more engaged in these brokerage programs. But as you can see, in 2020, when we started, and we started right before the pandemic, and then it sort of, was a little slow there in the beginning, but then as the pandemic started to end, you can see now we don't have the last 6 months for 2024, but I can tell you that we're going to hit around, by the time they get the reporting in, we're going to hit over 40,000 rides for 2024. Next screen. Okay, so how does it work? We have multiple locations throughout the state where we have call centers. So example is, if you haven't heard of the Upper Peninsula, it's 15 counties. It has a call center for those 15 counties. There's around 280,000 people that live up in that area, but to get from one side to the other side, it's 8 hours. And one of the things that we wanted to make sure is that people were able to get to non-emergency medical transportation. And when you live in rural states, most of you know that the medical facilities aren't necessarily in your county. And so many of these transits would, we've made agreements with them, and transits have made agreements that they can cross county lines so that they can get people to the services. And again, back to transits, you know, by having them engaged in this process, we know that that the people that they've hired, they've gone through different criminal background checks. They've had to have training. The vehicles are in good shape because, you know, it's required to keep those vehicles in good shape. And we know they have insurance. And we know they're probably a lot cheaper than some of the private sector out there. Okay, next screen. So what we also try to do is we try to get providers to use smaller vehicles because it's almost a one-on-one service. Sometimes we can pair up with a couple, but not a lot because of the way things are set up in our state where the hospitals are located, the medical facilities are located. Next one, next. Okay, so we build partnerships. That's really what's key in the service. We as a broker go out and find these partnerships. And these partnerships then work out an agreement with us. And what we do is, and they make referrals of rides besides Medicaid, which I can talk a little bit about, but besides Medicaid, all the other ones, we try to provide some type of fare assistance, and that fare assistance usually comes through the hospital or comes from a medical center or comes from whoever our partner is willing to pay to get that person to where they need to go. And then all we do is then we contact the transit agency to make that transport. So you can see the different partners that we have made. So if you go to the next screen. Okay, so of course we have Michigan DHHS, and we are working more with them. And I just want to say that at the summer annual conference for transits in Michigan, I spoke at the transit conference with Scott Boburn from CTAA. He covered Medicaid, and then I covered all the other part. Even though we do Medicaid, he's much more knowledgeable on Medicaid transportation and what's happening. And so we wanted him to talk. And it was a really good dialogue among many of the transit agencies, especially the urban areas, because they're seeing now what's happening in the rural areas. They would like to get engaged. And the big thing is for transits is they want to get a fair price, you know, for what it's actually costing to transport, especially because it's a premium service where you're doing one-on-one. So as you can see, we also have, we work with substance abuse treatments, we work with the veteran services, My Michigan Healthcare. It's a big hospital, which is now connected to the University of Michigan. We also have a healthcare plan for the 15 counties in the UP, where we provide all their service for them. We have 2 area agency on aging, which covers 25 counties. Of course, National RTAP provided funds to get a program started in 10 of the counties, which from that, we were able to get $300,000 to expand that to 15 counties. And we're doing quite well in those areas. And then we always are partnering with the Michigan Department of Transportation, FTA, and assisted living centers, county mental health services. And we also have a private pay passenger assistance. So if a person calls us directly, not say the partner, and they just want to pay for the service, we can do that for them. So so I think that's a real add-on, because there are many times people can privately pay. The cost is much more than just a typical bus ride. It's more than a bus ride because they're getting a one-on-one service, and they're being picked up at the time they need to be picked up, brought to their appointment, and then being brought back. Next slide. So, you know, so we're trying to think bigger than the traditional non-emergency medical transportation. So, and I should just say that, I think I spoke maybe a couple months ago, we are now in a dialogue of doing a similar type of service with rides to work. So it's going to be interesting to see how that all develops, but you could see some of the examples on, on especially area agency on aging. They want people to be able to go to the grocery store, the pharmacy, other appointments that they have. And so we do those services for the area agency on aging's My Choice Waiver Program. So we get the people to and from where they have to go. Next slide, please. Okay, so there is a premium fare that is charged. Okay, I'll give you an example is if you're, say you're in Bay City. Oh, I don't want to use Bay City because that's a small urban. Say you're in Traverse City, that's a rural area, and a person needs a ride. They have bus service there, but it's maybe $1, $2 for that ride. But if they need to be picked up there and they need to go to the hospital or they have some other appointment, whether it's in the county, they have it, that transit agency has an in-county rate and has an out-of-county rate. The in-county rate is sort of a fixed rate by most of them, and the out-of-county rate is an hourly rate. We do not determine any of the transit's rates. They tell us what they want to charge, and then we include that in the agreement, and we include that in the agreement with the partners who are paying for the service. So, so the partners know upfront how much is it going to cost. I can tell you that most of the transits charge around $60 an hour when we're going out of county. And just recently, most of them have upped their fares to $20 one way for the one-on-one service where they're picked up at home and have to be brought to where they need to go in the county and then picked up back. So it's around $40 round trip. We are lucky also to have new freedom funds. And so if they're 60 years of age and older and they are not Medicaid eligible, we can help pay for half the cost. If they're a non-senior citizen or if you have children, all of them have car seats, and there are car seats put into those vehicles so that they can transport children. And most of it is their single rider trips. Like I said, we're going to try to work on where if some of these, if we could get, we need to work, and that's what we're working on more. We're applying for some more grants where we can maybe get some of these doctors or these hospitals to, sort of pair up some of these trips. I'll mention dialysis only because we only ones that we can fund in dialysis is if the hospital pays or if Medicaid pays. If they don't pay, then it becomes very difficult because, you can't afford that many trips a year, to pay for that individual. So that's pretty expensive, but, and so we try to pair up if we can with those type of services. Next slide. So we get grant funding, and we get a lot of funding from foundations. We get funding from the Michigan Health Endowment Fund. We get funding from the Blue Cross Blue Shield. The Aspirus Health Foundation is from the western part of the UP, and we have to cross borders. We have to go into Wisconsin. We have to go into Minnesota. We have to go into Ohio because, those are our borders. And a lot of them, if there's major health care, they got to go across county line to get to that health care because they don't have them in their county, or they have just a little, little center there where they have to make referrals for more medical needs. Okay. And then you can see other foundations. We get MDOT grants. Okay. Next slide. Okay. So we operate from 8 to 5. If you call that number, there's only really 2 options. You get 1 Upper Peninsula and 2 Lower Peninsula. So you just press the button where you live, and then there'll become an operator will come on, and they will talk to either to the partner or they will talk to the individual. Now, we do have some portal systems, but not everybody is geared up for portal systems. And there's some areas that it's going to take some time with portal systems. And it's a discussion we're having with the state is how to get the medical field more engaged into portal systems, and it would probably make it a lot easier. But then the little trip request form, what we do, we can send that over to the transit agency, gives the name, it tells location, it tells them, you know, they need a wheelchair, do they need whatever, and this is the time they need to pick up. Some of our agencies, though, from 8 to 5, they call it, we set up, we also have what we call, let me see, what we do after services, because discharges are big. And so some of the rural areas are willing to do discharge. And what they do is they pay a driver an on-call fee, say from 6 o'clock until midnight. And then when they get called, they get paid for that time to go pick up that individual. And but then they call us the next day and we book it in, and then we take care of the billing. But we do some of that a little bit because it is needed. And if they know if a person has to be picked up earlier in the morning, that's set up the day before. We're pretty good at, you know, getting, you know, the service taken care of because we've been doing it for a while. And you know, we really have good workers there. They're almost like sometimes outreach workers because they always are looking for solutions to try to figure out how to get that ride from point A to point B for that individual, because, you know, we live in such a small area that they sort of know everybody. So anyway, next slide. So moving forward, we're doing a lot of different things to move forward. We continue to get more partnerships coming in. We continue to get more transits coming in. And I have to say that, you know, I have some small urbans now I'm starting to work with. And I think it was a week ago, I got my first urban system. And one of the reasons is that they just don't want to do all the paperwork, especially the Medicaid paperwork. And sometimes there's some other paperwork that has to be done. And for them, it's just easier. All they have to do is bill us, tell us the name of who the rider was. And if it matches our system, then they just get paid. So we are, like I said, we're continuing to expand. It's very exciting. I'm happy to see that people are able to get to their medical appointments. I'm happy to see hospitals on their no-shows are coming down because we're able to provide this service. Because it's a real concern with the medical field right now, because there's a lot of no-shows when you live in rural areas. People just don't go to their appointments. You know, we call and let the person know, okay, you have this appointment. Are you going to be able to make your appointment, so that we can cut some of the no-shows also? Because I know a lot of times nothing's more frustrating if you go to a house and all of a sudden the person doesn't come out, or they don't no-show, or they didn't call you because they were sick for the day. You know, we are tackling all of those problems. And so, like I said, it's exciting. And I guess that's sort of it for right now. So, and if there's any questions after, I should mention too, the other thing we did, we bought, well, I shouldn't say, we are in the process of purchasing right now 8 vehicles. That could be more. They're hybrid EV vehicles for transit systems and charging stations. We got money from FTA, and what we are going to be doing is placing those charging stations in different locations in the state. We have located where they're going, and we also have located where we're putting the vehicles. And we are not going to own those vehicles. We're just going to outright give them to the transits. And we know transits who are growing, who don't have enough vehicles, they're the ones who are going to get these vehicles. So that's sort of exciting too, to be able to give out vehicles to transits, because transits can always use new vehicles. And I was able to convince FTA that because we're so rural, that if you go 280 miles, an EV vehicle just isn't going to be the case. So I asked them if we could do a combination of EV hybrids, and we got that approved. So that project's moving forward. We're ordering those vehicles probably next week. So so that's where we're at in Michigan.
Well, thanks, Rochelle. That's a lot of stuff going on there.
Yes.
Big program. I was, you know, with my computer problems at the beginning, I forgot to introduce who I am. So if any of you are wondering who the heck I am, I'm one of the staff at National RTAP, Scott, and Rochelle was actually one of my I was one of the people that I was overseeing a grant for. We kind of split it up between staff, and I had 6 of them. Our next presenter is going to be Wendy Schuyler, presenting on this was not one of my grantees, so pardon me if I get the pronunciation wrong, but the Ark of Chemung, Schuyler, is that? Yep.
Schuyler, yep.
Okay. And do we have the presentation? Oh, here we go. So yeah, we did kind of calls throughout this project, which were really good for knowledge sharing. So I know a little bit about this project, but again, it wasn't one of my grantees, so I'm looking forward to hearing about it.
All right. My name is Wendy Shutter. I'm the Director of Business Services at the Ark of Chemung Schuyler. We are the operator for public transit in Schuyler County, New York. Our transit system is called Schuyler County Transit. Next slide, please. As mentioned, we are one of 19 recipients. We have had a long-standing request to expand our transit system pretty much from its inception to be able to provide transportation to Elmira, which is the city directly south of us. This grant allowed us to kickstart that project, to start the route and see if it could be viable. Next slide, please. So Schuyler County is located in, and you can pick your poison. It's upstate New York, Western New York, Central New York. In any case, we're in the Finger Lakes region of New York. We are a small in geographic size and population county. Okay. The population density for our county is only about 53 people per square mile, whereas if we headed either south into Chemung County, where Elmira is, to the west to Corning, or to the east to Tompkins County, where Ithaca is, the population density is much higher, which means there's a lot more services located in those counties. Next slide, please. Schuyler County Transit itself was founded in 2010 with a dial-a-ride service and 2 what we call village connections, which was 2 buses that basically went through the villages within Schuyler County. Over time, we had added additional routes, one to, as I mentioned, Steuben County, which is where Corning's located, and one to Tompkins County, where Ithaca is located. Those services, when we looked at where to expand, it wasn't just based on user requests, obviously that factored into it, but we always tried to build services that we knew we could layer on top of areas that we were already providing supports for people to, so we, in a way, would have guaranteed ridership. And we never really had that heading south into Elmira, but that did change when we integrated, we merged with the Ark of Chemung. So the 2 counties' Ark chapters merged together. And we have 2 campuses now. We have one in Watkins Glen and we have one in Elmira. Next slide, please. So if you're looking strictly at the Schuyler County region, our population has a significant portion of it is low income, elderly, and disabled. We have a lot of tourism in our area, but that's more so the types of jobs that tends to create are service-oriented jobs, more that are seasonal. The more permanent jobs, and certainly the more healthcare services and social services are located in the cities surrounding us. So what our population wanted, who are our users for public transit, was a way to get to the Arnott Mall, to shopping access, which is the Arnott Mall, Consumer Square, Southern Tier Crossing, which are all in Chemung County. And what we were hoping this route would do, besides getting people to all these different service types, was we thought it might also open up the possibility for people in Elmira area, low income or who don't drive, the ability to get to Watkins Glen, where we have a lake, we have a park, we have a New York State Park in Watkins Glen with beautiful gorges. We have lots of trails. Next slide, please. So the corridor that runs from Watkins Glen through the village of Montour Falls down to Elmira, so the red route, is State Route 14. And when you pull traffic data for that route, it is a busy route with primarily commuters on it. It does run through two small villages, the village of the hamlet, I believe, in Millport, and the village of Pine Valley, or I may have that vice versa. So we worked closely with C-Tran, which is the public transit service in the Elmira area, about how we would run. The idea would be that we would run open door until we got into the Horseheads region, where we would then be closed door and only stop at our advertised stops. So we could pick people up in, say, Millport and Pine Valley, but once we got past those areas, we would purely rely on public transit passengers getting on the advertised stops. There'd be no deviations and no flagging along the route. Next slide, please. So some of the features of this route is that we would stop at locations that are easy park and ride locations. Within Watkins Glen, we have a Tops Plaza. In Montour Falls, there's a human resources complex, both of which have large parking lots where people can leave their cars if they have one. But these are also two locations that are serviced by Schuyler County Transit's other routes heavily, so people could make connections there. We also saw the Arnott Mall as a possible park and ride stop, and from looking at the C-Tran schedules, the Arnott Mall is one of their heavy stops in which you can connect to lots of other routes from there. As I mentioned, State Route 14 South is a heavy commuter route. We formed a committee with people from our partner on the job was Workforce New York. And we had representatives from the planning department in Schuyler County. We had representatives from mobility management in Chemung County. And then we had our own mobility. We also operate mobility management in Schuyler County. We have our mobility manager on our committee. And then we broke off various subcommittees to design our route to hit all of these major stops. The only one I didn't mention was the Elmira Transit Center, which is right down in the heart of the city of Elmira and is serviced by lots of different other options besides C-Tran. So our initial plan was to run one early AM loop and one PM loop to help commuters, and then two midday loops for everybody else who wanted to ride it for any reason. The added bonus of doing this was we knew we would always stop at our other campus in Elmira, which is located on Sullivan Street, which is very near the Elmira Transit Center, which would allow us to connect our two campuses together. So if you're not familiar with an ARC provides lots of different types of supports for people with developmental disabilities, one of which includes vocational support for people who have disabilities who are trying to get out into the workforce and get jobs. And we were hoping this route could be used by our vocational department to do travel training, to allow the people that they're supporting reach job opportunities and exploration opportunities in Schuyler County and vice versa, residents of Schuyler County to go to Elmira. Next slide, please. Next slide. So we launched Elmira Connections with funding assistance from National RTAP on January 17th, 2020, in the middle of a 2-day snow event, which made it nice to not have to worry about whether or not we were hitting our stops on time, because everybody was running behind. But after just 11 days of operation, our metric for success and that this route was viable is to average 10 riders a day. After 11 days, we hit our first 10 rider day. The route has continued to operate even after we exhausted the National RTAP funding and converted it to a 5311 funded route. We have maintained that ridership, and I'll talk a little bit more about that. Next slide, please. The changes we've made since I did the final report for the project is we've updated our direction, our turn-by-turn directions and our GTFS feeds for the route. We actually added Elmira connections to our GTFS feeds and updated them on 511 New York and Google Maps and Apple Maps. We did that GTFS update with the help of National RTAP. And we altered where and how we turn in that Arnott Mall area, because in that same area we learned that our passengers were trying to get to, there's 2 Guthrie Hospital complexes there, and there's also a federal Social Security Administration office there. So we altered our turn by turn to make it easier for people using those services to flag the bus. The just in that general area there. The other things we've done in general, not specific to Elmira Connections, is just this summer we transitioned from using Route Match to Trip Master. What this software is doing for us is lots of different things, but some of the really neat things is with the old software where we only tracked pickups, now we can track pickups and drop-offs. Passengers can now purchase reloadable plastic cards for paying for their rides. And we are just now starting to introduce the ability to reserve a ride. And when they do that, they can use a service to know when their ride is coming. It'll automatically alert them when the bus is coming if they do a reservation. And tomorrow we start No Fare November, which we like to do. We like to make that an annual thing that we do for our ridership. And though we're introducing it November 1st, it goes effective December 1st. We, as a result of all of these changes, including adding Elmira Connections, we redid our entire fare structure just to make it simpler for everyone. When you sort of grow a route, one route at a time, the pricing kind of got very convoluted and confusing. We're simplifying all of that. Next slide, please. So this shows you what our ridership has been like since January 2023 through now. And there's ups and downs all over the place, but the trend line stays right around that average of 10 per day. The fluctuations you see, because the ridership is typically so low, the fluctuations tend to be, a couple days of severe weather will throw our numbers off. A 2-3 month construction project, which happened this last summer along State Route 14, people stopped riding because the bus was always late. But once the construction project was done and the bus was back on time, people started riding again. I pulled the data from September. We'll take a little closer look at that, but the busiest day we've ever had since the route's inception was 35 riders on just this last summer on July 25th. Not exactly sure what was so special about that day. It might have just been a nice day for people to want to ride the bus and get to either shopping or to Watkins Glen. Next slide, please. So doing a deeper dive in our September 2024 data, because now we have the new software, we can see that, and I'm sure moving forward, we will look more closely at this to see if this trend continues. But our most popular pickup sites for this service are that Elmira Transit Center in downtown Elmira, and then pretty evenly split between the Arnott Mall complex, Human Services, Tops Plaza, and then various flag stops along the corridors. It's about 11 to 13% each. 12th Street is where our administrative offices are in Watkins Glen. And in that same complex, we have a public health building, we have another hospital service, and we have a school. So it's a busy area there. Our most popular drop-offs are the Elmira Transit Center and the Arnott Mall. So on just 1 month's worth of data, one of the things we saw at the very, very beginning, when we first started this, we did about 3 months free fare. I think it was about 3 months, but we did free fare for a few months. We noticed by looking at the ridership that residents within Chemung County were using our route over C-Tran to get between Elmira Transit Center and the Arnett Mall complex. And we think part of that reasoning is that it wasn't that we were necessarily cheaper, though. When we were free fare, we were definitely cheaper. But the reason I think we still see a little bit of that now is because the C-Tran system doesn't have a lot of direct routes between those two locations. And for C-Trans, those are their two hubs to get to everything else. Once you get to that Arnett Mall, there's a 30-minute shopper shuttle that'll take you to just a variety of stores and services. And of course, Elmira Transit Center isn't just serviced by C-Tran, it's serviced by several different busing lines. Next slide, please. One of the goals for our service was to provide disability supports for the ARC, and I can happily say that is, I'm sort of transitioning now into some of the success stories. That is part of what it has actually done for us, for the ARC. We've had people use it in both directions. We've had people who primarily used to only come to our Watkins Glen buildings, who have now been able to independently ride the Elmira Connections bus to our Sullivan Street campus to either participate in activities there, go to clinical services there, or explore jobs that we have strictly in that building, and vice versa. We've also had job coaches use it for travel training to teach people how to use public transit. So that aspect that we had hoped it would be helpful with is definitely occurred. Next slide, please. The other, like, I just thought it was cute and enjoyable, but one of the other aspects of this that I would consider a success story is our annual staff picnic is right on that route, and our staff use it to go to the picnic, which is kind of fun that there's people who are able to make it to the staff picnic who might not otherwise be able to make it. Next slide, please. Then the last two stories I wanted to tell come from our mobility manager. And these are actual passengers that she works with on a regular basis. When I was asked to do this follow-up presentation on how that route was going and if it was still successful, I asked her if there was any people who were using the route that she thought their stories would be worth telling, and she gave me these two stories. The first one is John, and he uses an electronic wheelchair and is able to use both our Village connections and our Elmira connections to get to the places he wants to go to. And often that's in Elmira. There's, like I said, there's a lot more shopping opportunities in Elmira. He also has his doctor's offices are there. He can get to the mall, and once you get to the mall, there's a C-Tran shopping shuttle that he takes advantage of. His doctor's offices visits are at that Guthrie Services that are right there near that Arnett Mall. So we can deviate into the parking lot in order to pick him up because we got to be able to drop the wheelchair lift to get him onto the bus. So it's allowed him to continue to living and going to the places he's wanted to go. Next slide, please. My other story that Jen provided me, our mobility manager, is about David. He's a veteran who used to go to Elmira to do lots of things. That's where his favorite grocery store is. He's familiar with that area. He's unable to drive himself anymore. He lives in an elderly, low-income housing unit in Watkins Glen, and he has become the ambassador for that unit to help other people who live there learn how to use transportation, and opening them up to the ability to use Elmira connections in particular to get to things like the mall and to his favorite grocery store. He has had to make a few changes because it is a long route. I want to say around one-way trip is about 45 minutes. So, he can't buy ice cream on a day when it's 90 degrees out because it will melt on him. But that's okay. He still uses our local stores for things like that. He's learned that. and still uses the Elmira connections for other services and other things he wants, and to still get to his favorite grocery store. Next slide, please. So what's next for us is the ARC, who is spearheads the Human Services Coordinated Transportation Committee, is actually going to answer that question right now. We are working with two different groups to sort of assess what's happening with Schuyler County Transit, what our current offerings are, how it's being utilized, and what the population in Schuyler County needs or wants moving forward. The first part of that is we're partway through something called Design Connect. If you didn't recognize it, Ithaca is right next, is the home of Cornell University. We get certain advantages to being right next door, and we were selected by their group of students who are all either graduate or undergraduate urban planning students, and they're doing an analysis of our current routes and the population of Schuyler County on how public transit should maybe be changed moving forward, where we're doing things well, where we might need to reconsider things. And then on top of that, we very recently were awarded a NADIC grant to do a more comprehensive transportation plan. When we launched Schuyler County Transit in 2010, we had paid a commercial service to come in and do an extensive survey of the area to answer all these questions. That survey was in 2007, and the entire world has changed since then. So we are more than overdue with needing to do another analysis and another survey of what makes sense now for public transit for our region. Next slide. And that's about it. We are the contracted operators with Schuyler County. We present monthly at the county legislature to keep them updated on the status of all of public transit. And we are incredibly thankful for the funding that we've been able to receive, and all the support we received through National RTAP to maintain our programs. And that's all I have.
Great. Well, thank you. I know that we are slightly over time, but I just wanted to thank all of our presenters. This is kind of our final deliverable, if you will, for this round of the grant program. And especially, I know Rochelle is actually sick, so thanks for rallying and coming on. Anyway, there was a question that somebody asked, and it was answered, but I wanted to just, throw it out there for everybody to hear. And that one of them, it was for Rochelle, and it was, are you seeing much use for employment connections? And her answer was they're just kind of getting into it. I don't know if you want to speak any more to that or not. And at this point, for anyone who's still here, we can take any other questions you may have.
Yeah, we're going to be doing it in the western part of Michigan, and we're working with a small urban over there, and we're working with the state employment agency, and we're just in the design stage right now, but we know there's a really big need for transportation to and from work, especially in the rural counties, because there's not always work in the rural counties, and there's a housing issue. As we know, there's a housing issue, so people just can't move to another county if there's work there. So we're working on those issues. We hoped, probably a good question to ask me in around a year.
Yeah, I was one thing that struck me about all of these projects is kind of like the just different uses of the services, and I know it's in Michigan, it's a lot of it has been focused on healthcare, but people need to get different places for different reasons, and I've seen throughout this whole grant project everything you can think of, from employment to entertainment to going to a picnic, like in our last presentation. So it's really encouraging that these funds were put to good use to get people's quality of life up. And with that, I guess we can talk a little bit. I don't see any other questions in the Q&A. Feel free to drop them there if you want, but I'm just going to go over a couple things that are coming up. I don't know if Kara wants to jump in, she can as well, but some upcoming events for National RTAP. We've got a Mobility Wallets 101. These are, webinars. I believe all of them are webinars. That will be on November 5th at 2 o'clock. And then we've got updated marketing toolkit introduction. So we just updated our marketing toolkit. And if you're not familiar with our toolkits, they're quite comprehensive and they're great for kind of overall look at different topics. And marketing, as we all know, is a key part of transit. So, and then we've got succession planning, LinkedIn Learn Along. So that is not a webinar, it's a LinkedIn Learn Along. And then Books in Transit discussion group. If you're not familiar with that, we do a Books in Transit every few months. And this one is called The Lost Ticket, and that will be on February 20th in 2025. You can find all of this stuff at our website, nationalrtap.org. And we also, I should put in a plug for our 6th annual or biannual technical assistance conference. It's going to be in Austin, Texas, December 7th through 12th. And that, still early days on that, but mark it on your calendars, because that our conferences are always it's a kind of a lot of information that transit managers and others really get a lot of value out of. And yeah, so our information is here. Mine is Scott, and Karen Dumaine